Hi everyone, I'm Dr. Haider Ali. We're going to dive into springtime today and talk a little bit about how this season can really affect your lungs and your symptoms. And we'll go into a little bit about what you can do to protect yourself in the next few months. Spring is finally here, the sun is out, the flowers are blooming, and for millions of us with lung disease, our chests are starting to feel tight. If you have COPD or asthma or bronchiectasis, spring fever means something totally different. Today, we're talking about how to survive and actually enjoy this season without a flare-up. So why does spring hit our lungs so hard? Well, it's like a triple threat, right? First, there's pollen, then trees like oak, birch, maple, they're pumping out microscopic seeds that your immune system sees as invaders. Second, we have temperature swings. Where I live, one day it's 70 degrees, the next day it's 40 degrees. That rapid change can cause your airways to twitch and tighten, and something which we call bronchospasm is that tightness you feel. Third, humidity. As the air gets heavier and wetter, it's literally harder to pull into your lungs. It's like trying to breathe through a damp cloth. So you wouldn't leave the house in a storm without an umbrella, right? Well, you shouldn't leave the house in spring without checking the AQI, the Air Quality Index. I use an app called airnow.gov. It uses a simple color code, green and yellow. You're usually good to go. Orange, that's unhealthy for sensitive groups. That's us. If it's orange or red, that's stay inside day. Also look at the pollen count. Most weather apps show this now. Tree pollen usually peaks around the early morning. So if you want to walk the dog, you want to try waiting until the evening or right after a good rain has washed the air. Your home needs to be your sanctuary. In the spring, it's tempting to let the fresh air in. Don't do it. Keep those windows shut. You're just inviting a billion pollen particles to sleep on your pillow. Instead, use your AC. Make sure you have HEPA filters in your HVAC system. If you can, get a portable HEPA air purifier for the room, and especially put that in the room you spend most of the time in. Here's a pro tip you might not think of: the shower reset. When you've been outside, pollen sticks to your hair and your clothes. As soon as you come home, change your clothes, rinse off. Don't bring the outside into your bed. Right now, let's talk interventions. Hydration. I say it all the time, but water thins out mucus. Thick spring mucus is a magnet for infections. Pre-treatment. Talk to your doctor about starting allergy meds before the symptoms get bad. Nasal steroids or antihistamines work best when they're already in your system. The mask up. If you have to do yard work or the air quality is poor, wear an N95 mask. It's not just for viruses, it's a physical wall that stops pollen from reaching your lungs. Have an action plan. Make sure your rescue inhaler isn't expired. Make sure you have a written action plan from your doctor so you know exactly what to do if you start wheezing, getting tight, or coughing. Spring doesn't have to mean being stuck inside. It just means being a little bit more strategic. Check the apps, keep the windows closed, stay hydrated. But remember, if your cough lasts more than 3 weeks or you're using your rescue inhaler more than twice a week, call your pulmonologist. Let's enjoy the flowers without the flare-ups. I hope you've enjoyed this video. We'll see you back here for some more content soon. Take care of yourselves. Bye.